Hello, let's dive into another topic this week. You probably heard a lot about it in the media, and let's talk about the myths that are around about testosterone in menopause. So, if I ask myself a question, what I need to know as a woman who is going through menopause about testosterone, I will start with the basics. So, is testosterone a female hormone? Yes. So, along with the estrogen and progesterone, it's one of the three sexual hormones that we as women produce in our body, mainly from ovaries, but also from adrenal glands. So it has got a role in sexual desire, obviously, but also in the mood, energy levels, as well as muscle and bone strength. The testosterone levels do change with age. We have probably the maximum level of testosterone we ever going to have in our early 20s, 1920s, and then from then it is a decline. The rate is supposed to be around 5% every year. So as you can see, the levels of testosterone fall much earlier than the other hormones like estrogen and progesterone, which start falling after 40. So we already are starting with a whatever is supposed to be forever kind of level, even before we start going through menopause. So it is not something that we have to address only at that age. So should it be replaced just because the levels are low? No, not really. And because the physiological, symptoms or benefits of testosterone do not correlate with the blood levels, because not all of it is freely floating in the blood for us to check. It is also bound to some tissues, and also there is no relation between the symptoms and the level of testosterone in the blood, because there is a precursor hormone called DHEA, which converts to the other sexual hormones, and it happens in the brain. So when they looked at it, the levels do not really correlate with the symptoms, especially if it is about libido. So who should be offered testosterone? According to NICE and the British Menopause Society, the indication at the moment in UK is for mainly who have been diagnosed with low libido or low sexual desire disorder. Can it be given on its own if somebody is not already on HRT? Not really, because the estrogen has some benefits, and not only with the libido but also other symptoms. So HRT in terms of estrogen is still the first line. What about the potential benefits? Because everybody is talking about how it will prevent muscle loss, gives you strength, your muscles, and your fatigue levels improve, mood improves. At the moment, there hasn't been any long-term studies. There are some randomized control studies, but they're not done long enough. So we do need more data before we know whether it is true or not. Is it licensed in UK? Unfortunately, there is no licensed testosterone product for women in UK at the moment. The main reason why I see it as is because number one, there is no long-term safety data. The only country which has got a licensed product for women is Australia, and it's called Androfem. Some private menopause clinics do prescribe that. The other main reason is, as with many other things, women's health research is a bit lacking. There's not a lot of, pharmacological company funded research. So there's not a lot of finance to do further studies about it. But hopefully it will change in the future. But at the moment, it's not licensed. So just to sum it up, for now, yes, testosterone is produced by us, and it's a female hormone too, although the levels are much smaller than men. The levels of testosterone fall to whatever the baseline is when we are in our 30s. So it's not that in menopause suddenly we notice a sudden drop, as we see with other hormones, and it's not always that it will make a difference to the libido. It may make some difference, but usually it's the biopsychosocial model that we as clinicians are recommended to tackle the libido issue, because there could be dryness down below, and taking estrogen as a pessary or cream may break that vicious cycle of pain and mental um, you know kind of barrier, and also there could be psychological issues, stress, or relationship issues that need to be addressed that will make a difference to libido rather than testosterone by itself. But in spite of addressing all those issues, if still it's an issue with loss of libido, yes, we can under NHS prescribe testosterone, and after checking the blood levels of testosterone, a 3 to 6 month trial. And in those 3 to 6 months, if there is significant improvement in the libido, then we usually continue it for 12 months and then review at that point of time. So yes, it is available to a small proportion of women for whom it is appropriate. See you next week with another topic. Thank you.